that has, I don't know, 13 different sites where they collect data from families, genetic data, biological data, and other kinds of data that they're trying to use to make meaningful information. So they tapped into the people who've already participated and sent out a survey. And this just gives you some of the, the characteristics of who responded. They found that 63% of families reported severe disruptions in services and therapies. So over half, right, are feeling disruptions in what they were already getting. And of that, 64% of families reported that speech therapy was the most disrupted. And so these are certainly areas to think about and how this could be improved, right? The settings that are most disrupted are highest for school settings, which isn't surprising. I think 98% of the folks who responded said that school was canceled or that online courses were part of the new normal as a result of the pandemic. And just over half reported that their professional clinic was disrupted. And so in Atlanta, I know the autism clinic has not been open since March, which is really concerning because when I observed there could be up to 20 families that come in that one day. It's open 3 days a month. And so that's 60 families times 3 months. That's a lot of people who are not getting services. So I'd be curious to hear from folks here what services have been disrupted from your perspective, and to what extent. So that's sort of an open-ended question, if we want to talk about that. What sort of services have been disrupted in your experience as it relates to, families and children with autism? Anyone want to share?
Well, we at the Department of Behavioral Health, we have, of course, have a lot of staff who have not been able to shelter in place because they do serve young people. We've been working on building a crisis continuum for young people on the spectrum. And we work very closely with some of the psychiatric residential treatment facilities in the state that serve, and actually there's really just one of the PRTFs that serve children on the spectrum, and that's Laurel Heights on Briarcliff Road. And so we've been working hand in hand with that organization, the medical director and the CEO. And they've been working every day. And in fact, I just spoke to the CEO on yesterday morning, and he said, they were prepared, and so services have not been disrupted. Of course, they can't be. The kids are, living residentially there. Have restricted contact with caregivers, though.
Yeah.
And that's presented its own set of challenges that the kids can't see their families in person. Yeah. Family therapy is taken on a different look. And so that has continued. Our crisis units continue to accept kids. But in terms of the numbers they can accept and how they've had to try to maintain social distancing but serve the kids safely has been a challenge. So but continuing to see those services being operated because we have to. It's crisis and residential. Right.
Thanks for sharing that. That's so important in thinking about, the kind of isolation that the kids might be experiencing because they can't see their families and how stressful this is for the people working, right? While so many people do have sort of like at home, those of us who are privileged enough to work at home online, that's just not an option, right? So any other folks want to share any, like in terms of thinking about services that have been disrupted or maybe not disrupted or altered in your area? Yeah, okay. So the settings that were least disrupted, just sort of looking back at this graph here, were home care, daycare, and residential programs. And, my guess based on my experience is that maybe there's just less services that people access in this regard. It's being reported less as being impacted, but I don't know. I would, again, I'm curious to hear how this is impacting other folks, like we heard from Dr. Pearson. So I think what's most alarming from this survey are the low percentages of families who are receiving remote services of their therapies. 35% are receiving services remotely. 35%. And among those who receive those services, less than half feel that they're actually benefiting from it. So half of 35% think that they're actually getting some benefit. So that's a very small number of people, right? And to the degree to which this disparity is due to digital divides that exist in our country, and this is something that we talked about with Dr. Magana when she presented last week. According to the Federal Communication Commissions, it's estimated that more than 21 million people in the United States still lack broadband connectivity, right? This is partly due to people who live in rural areas and people living in low poverty areas. And the thing that was important that Dr. Magana also brought up was, it doesn't account really for, you might have broadband, but you don't, maybe on your phone, but you can't afford to pay for the data, and so that's a barrier as well. So the way in which we even measure this could be problematic. And research shows that 40% of schools lack broadband. That's like almost half. And 60% of the healthcare facilities outside of metropolitan areas. So these rural areas and schools can't even offer this service, right? So this is a real concern, especially when we think about our own internet use now, right? Here we are, this very breakout session and others, which provides resources and knowledge to people who can access the internet. And some say this is a conservative estimate when we think about download speeds. My parents, they're pretty old. They have a dial-up internet. I can't use it. It takes forever. And again, the cost for just using data that many people might not have access or can afford. Yeah.
Dr. Singh, these statistics are nationwide. Do you know how Georgia compares? Is it comparable?
That's a good question. I would love to see what that's like, because I was trying to, I know that, and I had posted this when we were having this discussion with Sandy Magana, that, there was some companies that were offering free internet service, but my guess is that it wasn't, but I don't even think it still exists. Like maybe it was just for a couple of months while we've kind of maxed out that couple of months, and school is out now. So maybe that service isn't being provided. But my guess is that it was kind of a lower sort of capacity in terms of speed and amount that people could use. Yeah, I think there's a lot to be investigated here in terms of Georgia.
I was going to say, I'm a school teacher, and I teach severe autism, and many of our students, well, not mine, but just within our school, I'm at a high school, most of them didn't have laptops or computers in their home. So our school gave out several Chromebooks, for the students to use.
Yeah. Where do you teach?
I'm in Barrow County at Appalachia High School.
Oh, wow. Okay. Okay. And were there enough laptops to distribute to children that didn't have?
I don't know. I know there were 3 distributions, but my students don't use them. But I just remember reading the emails that there were 3 opportunities for parents to come pick up Chromebooks for their kids.
I think it would be really interesting, just like thinking about Georgia statistics around digital divides, to have it. I mean, I would love to see sort of a survey just of school districts, in Georgia, to see what sort of the capacity they had in this moment. I think it would say a lot about inequities in education based on geographic location, which obviously overlaps with socioeconomic status and racial and ethnic minority composition. I think that would be a really telling display, right, of inequities in our educational system. I'm glad this is recorded so I can go back and like remind myself what some of these great ideas could be. Thanks for sharing. So let's move on. Just kind of some more statistics about this study. The survey also showed that disruption in services and therapies have negatively impacted their children, their behavior, their mental and emotional health. Likewise, a large percentage of parents and guardians reported feeling stressed and overwhelmed due to these disruptions, which has negatively impacted their mental health, which is not surprising at all. I mean, these are very high percentages of people saying yes. Overall, they're saying overall we feel good, right, on both our children and us, but it has seriously impacted us and our health. However, I just want to highlight the population survey for SPARK. Study is drawing on a population that is 70% white, 20% Hispanic, and 6% African American, even though the percentage of Black Americans in the US is 13%. And this is something, I teach sociology of science, so we have to be critical of how knowledge is produced and shapes our understanding of a problem, a social problem. But what I want to highlight here is that SPARK collection sites, there's many of them, but these are just shows you some of the sites. Here in Georgia, for example, the African-American population is 31%. So the SPARK study is concerning. You know, people are impacted, but we have to remember this is for a group of people who probably have more resources. I don't have access to the household income, whether they have public or private insurance, marital status, or mother's education level. But a lot of times these things coincide with one another and are forms of resources that allow people to participate in these kinds of studies in the first place, because they take time. They take having access to these clinical research sites, you know, Emory University, for example, which might not be accessible to folks like, especially like where you live, right? If you're living in a rural area. So that's something to think about. So the impacts are great for a very, you know, mostly white population. And we know that there's a long history of underrepresentation of Black populations in biomedical research, which is in part due to the lack of trust in science and medicine, you know, historically, and the abuse. You know, the most common case is the case of the Tuskegee syphilis study, you know, where Black men were you know, not treated for syphilis, even though there was a cure for it for over 40 years. Other reasons are likely due to lack of access to resources and that are needed to participate in such studies. Internet access is one thing we talked about. Regular access to medical clinics like the ones that the SPARK study is using. So I just want us to think about that. And so there is a growing, you know, there's a lot of data I could put up here, right? But there are autism disparities in the Black community. African-American children are more likely to be diagnosed with something other than autism. It takes longer for them to get an autism diagnosis, so the initial evaluation might be framed as behavioral problems, disruptive behavior, and the like. African-American and Hispanic children have poor access to healthcare services and are less likely to have a medical home than Caucasian children. African-American children are less likely to be represented in special education programs at schools. And these are all based on population-based studies, right? African-American children are less likely to access community services and receive recommended intensity for ABA. So if you just even look at, once they do get the services, the number of hours are dramatically different, which is, you know, we all know that the intensity of these interventions is important, and we're seeing disparities across the board. So now I just want to shift to, with this background in mind, I want to shift to COVID-19. And I want to share this first slide with you, as well as give you a glimpse of how COVID-19 is discriminating based on race, right? Which has led to higher fatality among African Americans. And if you don't know this, it's everywhere. I mean, it's on most news. It's becoming a prominent pattern, right? That is not surprising. So based on data collected from the Kaiser Family Foundation, it's a great resource. They do a lot of research and do really wonderful graphs and reports about things, all things health and health, care in the US. In the majority of states reporting data, Black people accounted for a higher share of confirmed cases. So out of 31 states, 20 states show that African Americans had a higher number of cases. And then out of 24 states, 19 of those states, African Americans had higher death rates. And so the column on the left just shows you different states, that show you the percent of Black people in that population, but the percentage that are dying, right, is much higher than the population, right? So in Georgia, for example, the 31% of our population accounts for African Americans or people who identify as Black, but 51% of African Americans are dying of COVID-19. So these are, Wisconsin is the worst. 6% of the population is Black, yet 29% of deaths are occurring in Black people. So this is a real concern. The right is just a visual. I'm a visual person too, and you see these patterns over and over again, where the dark here in Louisiana, Mississippi, Alabama, Georgia, South Carolina have higher percentage of mortality, so death among Black people. And so we see, these sort of patterns in the South in terms of a lot of different outcomes. This is just COVID-19, but we see similar sort of patterns when it comes to other kind of health conditions. So why does COVID-19 discriminate in communities of color? Who wants to give it, or what are some thoughts that you all have? I'm making you work.
That was the question I was going to ask you, because I hear so much about, some of it almost sounds like blaming the victim. Like, well,
right,
you have poorer, you don't take care of yourselves well, there's obesity, you smoke, you're diabetic. All these risk factors put you at higher risk for being impacted negatively by the virus. As opposed to really looking at the economic disparities, the systemic, institutional disparities, historic, and that have impacted people of color, communities of color for generations. And you reference some of them. Just, we live in more dense housing in some places. So we live generationally. So you might have grandma, granddad, aunties living in the same house with an adolescent who may not wear a mask every time they go out. And there's so many variables. And I think my concern is, that we continue to pay attention to the institutional kind of barriers and factors that contribute to folks of color being at risk for so many issues with health. It's just another one.
Right. Thank you. Thinking about just sort of the family structure is really important, and the density. That's really important, and it's important to think about how people are blamed for their demise, right? Without living like they're living in a vacuum, and nothing in their environment, nothing in the health policy, nothing in where public transportation is located, nothing about segregation of housing. None of these things are part of the conversation. It's just this is your problem because you made this choice, right?
And the fact that we are also overrepresented and sometimes in industry, like service industry, those jobs where folks, like you mentioned before, we have the privilege of working from home. A lot of folks don't. Right. So you're in the lower east socioeconomic group. Just what was on the news last night, the meat packing plant, Smith, how they told those people to come to work, we'll test you, but you come to work while you wait on your results. So folks are in there working among people who are possibly positive, told to go home until their results come back. and positive. And so who is that impacting mostly?
Right.
Primarily disenfranchised people, communities of color, low-income folks. And so you see us overrepresented in the COVID death rates as well, because we're working in those environments.
Right. Absolutely. Absolutely. Anyone else want to share or think about?
Yeah, I wonder, one of the things I've been thinking about is, we have issues of discrimination when it comes to testing, when it comes to sort of being able to access healthcare. So I think we've talked a lot about that. And then I think even when people are accessing healthcare, we know that folks of color face discrimination from healthcare providers. So speaking more to the death rate even, are Black people being considered for ventilators at the same rate as white people who present? And my guess is no. We know that, think about maternal death rates in our country. We know that Black women die at higher rates from childbirth because of discrimination on the part of the healthcare system. So why would COVID-19 be any different?
Right. Right. Erin, where are you coming from? I see half your face because I'm in a different mode.
I'm faculty at the Center for Leadership and Disability.
Okay. Fabulous. I see you now. I put you on a different, I'm trying to get everybody. And when I do that, everyone gets cut off. Yeah, that's really important to think about as well. So according to the Kaiser Family Foundation, let's see if I can keep going. Uh-oh, what happened here? Oh, here we go. There is higher rates of certain underlying health conditions compared to whites, and this is, communities of color, Hispanic as well, right, have higher poor health, not as great as health. There's higher rates of asthma, diabetes, heart disease, which again are related to, their environments in which they live, which have history attached to it. HIV/AIDS is probably one of the most stark inequalities that we see, where Black folks are 8 times more likely to be diagnosed with HIV and 10 times more likely to be diagnosed with AIDS. And again, this is predominant in the South, in the US South. You can look at maps that show like the hot zones of where HIV is happening. More likely to be uninsured and face barriers to accessing care than whites. People don't have usual sources of care. So what happens, right? When I think one of the stories that I didn't share with you was a young mother who, well, she wasn't so young. She had an adult son with developmental disabilities in New York, and she got COVID-19, and she didn't, she was worried about going to the doctor because she didn't want to leave her son, right? I'm not sure if she was uninsured or not, but accessing care was a problem for her because of her child's disability, or her adult son's disability, right? What was going to happen to him? So she kind of put off her own health, and then it was devastating because she died. But folks that don't have access to regular health insurance is a problem. And of course, this is tied, we can look at state level data. If folks are on Medicaid, we are a state that has not expanded Medicaid coverage. So that disproportionately impacts people with lower incomes. So, these things don't just happen, they're related. Another one, Blacks are more likely to face increased financial and health risks with COVID-19 due to economic and social circumstances. Dr. Pearson talked about, the overrepresentation of Black and Hispanics in the service industry, job loss of income or increase may increase their exposure just to maintain their jobs, right? Communities of color are also more likely to have income below the poverty line, right? And so losing a job or not having savings because you're furloughed or, is going to severely impact you more and affect your risk, certainly. This just shows people in lower income households are at a serious higher risk of being infected with coronavirus. And it just shows the different level of income per year and how that affects your risk, right, of being infected with coronavirus. And a lot of the, women that I talked to in the study that I did were personal care workers for people. So they were at the person's home, right? And they were working in the service industry. But we see that, women of color, particularly women, right, are long-term care workers are disproportionately lower wage workers, women and women of color. And we know that there's risks involved there too, right? And so we could spend the whole time thinking about a lot of different ways in which people are at risk and why communities of color, why COVID-19 is discriminating, right? Because of the structural inequalities that exist here. So I just wanted to end by sharing with you a study that I'm doing, and I'm still analyzing the data as we speak. I conducted a survey of quality of care at the Autism Clinic at Hughes Spalding that's run by Dr. Leslie Rubin. He started in 2002 to really address the service needs of low-income minority families. And I had the privilege of interviewing about 70 caregivers around the barriers that they experienced before, during, and after their children received a diagnosis of autism or developmental disability. Unlike most samples of studies that I read on autism disparities, the sample was mostly Black. These were single caregivers, mothers and grandmothers, and they relied on Medicaid. And so this just gives you some of the statistics of the population that that I was able to learn from. I did a grounded theory analysis to try to get a sense of what the social, structural, and economic barriers were to autism service disparities, right? Why was this happening? And in red are some of the quotes, but like socially, parents didn't have access to knowledge. They were extremely stressed. They had lack of time to really manage what they were supposed to do. And remember, a lot of these families were single parents, and they had limited social support as well. Childcare, respite care, a support system is really important. And then, many of these parents experience a lot of mental and physical health problems, or they had children with other special healthcare needs. And so these are compounding social issues. Economically, we could just see from sort of the descriptive demographics, Medicaid as a primary insurance has its limits on what is available to people, especially in Georgia, especially in rural Georgia, right? Employment is a big issue. This is something I've been studying with this data set and trying to understand, for those women that do work, how flexible are their jobs? We know these service jobs are not flexible. If you don't show up, you may lose your job. So what do you do when you get called from the school to come and pick up your child because they're disrupting the classroom? I heard that story over and over again, and many women do lose their jobs. And they're like, I can't even apply for a job because I don't pass the 90-day sort of window because I have to leave at a moment's notice. And so women are particularly impacted with this, and it's related to the gaps in our, the wage gaps that we see. So it's very political. Housing, if you're renting month to month, right, and barely making it, this is going to affect like where your priorities are in terms of where you work. Do I risk losing my job so I could take my child to therapy, or how do I negotiate these kinds of? People shouldn't have to make these decisions, right? Of life, like survival of life, housing over my roof, over my head, versus, making sure that my child thrives to their greatest ability. But these are the kinds of choices that people have to make. And then there's the structural elements, and these all work together. They're not in isolation. There's limits of service, whether there's not a lot of practitioners in certain areas, there's long wait lists, there's insurance limits. There's availability in terms of where services are located. One of the things I'm trying to do is develop a visualization of services in Georgia that shows where these services are and are not, and tie that to, you know, some of the historical structural inequalities that we see in Georgia. It's related to transportation. Imagine transporting your child with a developmental disability on MARTA, right? That is kind of hot and smelly and crowded and unpredictable, like all of those things that we know people with developmental disabilities and autism maybe not be keen to, or they're runners, or, you know, there's that sort of barrier in just the time it takes to get one place, and for all the different kinds of services that people with autism and their families have to negotiate. Education, we talked a little bit about this in terms of school systems, IEPs. You know, parents tell me that they don't even know their rights, right, for, you know, fair and equal education. And there's a lot of words that I've heard around this very issue. And then the bureaucratic process, the complexity of care coordination is overwhelming, even for an educated person, right? There's so many different, you know, providers, so many different places, so many different kinds of therapy, and it's just very complicated. The language of autism is very complicated, and then, you know, there's not a lot of continuity of care. And so these are sort of some of the things that I'm learning, right, from families about disparities that are looking at a lot of different, not at the individual, right, not as a, you know, like this is your problem, but really sort of thinking about social and economic issues. So this is sort of a framework that I modeled after Break the Cycle of Health Disparities that Dr. Rubin and his colleagues have every year. They have like a symposium. And so we really focused on the social economic, so income, employment options, education, social support, residential options, you know, what choices people have, the infrastructure of where they live, and the services that are available around where they live, as well as compounding factors, you know, especially for women who are single household parents, the kind of social capital that they have, that educational services, healthcare services are, you know, are compounding. And so these are some of the things that I'm thinking about. And I think the take home, really, we look at COVID-19 death rates, right? And what are some of the factors? And we look at like autism disparities and what are the factors. And I think the key takeaway is that these systems of inequality are related, right? They're not by themselves. We can look at, you know, cancer risk. We can look at heart disease. We can look at so many different kinds of health outcomes. And we will, you know, yeah, you're supposed to eat right, you're supposed to exercise, you know, there's all of those sort of individual targets. But when we start thinking about the structure, I think that's when we start seeing these commonalities. And I think that was sort of the key takeaway I wanted to provide and open it up for more discussion. Given your knowledge and experience with autism disparities in Georgia, how might low-income and minority children with ASD and their families experience greater impacts due to COVID-19, right? What are the social, economic, structural avenues that are going to impact people disproportionately? And what are the impacts going to be, right? Which will also be disproportionate based on some of these other domains. So that's really all I had. I thought maybe we could talk a little bit more. We have 9 minutes. I hope I wasn't talking too much, but once I started, I couldn't I was like, oh, but then there's this, and then there's this. Because, you know, this is really important. And I think it's an important moment for us to reflect on how these different inequities in our society, right, are affecting not only the families that have children with autism, but, you know, people with color more broadly, right?
Mm-hmm. Mm-hmm. Dr. Singh, I was also concerned you know, this was, thank you first of all for this presentation. It was fantastic. I'm glad I selected this one. It's exactly what I need.
I'm glad y'all showed up.
Thank you.
I spent a lot of time on it.
It really, I mean, it shows. So thank you for this, Jada. The other issue that I think is overlying all of this is the folks that we're seeing that are pushing back against the shelter-in-place orders, who are overtly now very aggressive, armed, hostile, and demanding that states reopen. And I've even seen some of them say, you know, like, sacrifice the vulnerable.
Right.
And it really makes me very, very worried, not just my own health and wellness and my family, but as you point out, these children are low-income and minority children with ASD who are already impacted by health disparities. Now COVID-19 is making it worse, and now you have people making it less safe for them because they want to have their economic, or whatever it is, their freedom that they're saying restored to them that lockdowns have restricted. So that, I don't know if you had any thoughts about that, but that has certainly made me even more concerned about vulnerable population, because you have a group of folks now saying, well, yeah, sacrifice them, because we want to be able to go back out to eat and go bowling and get a tattoo and go to the beach. And it's very worrisome.
Right. It brings me back to a comment suggested earlier, just about, and this is something that's come up in the disability articles, or just sort of news stories that I've been reading about how we're going to have to ration, right, ventilators, and folks with disabilities might be the first to go, right, because what is their worth in society? And I think it gets down to that question. People who are, I don't know what the population constitute, like who has time to go down and, like, say, you know, open up. I guess people who aren't working at Kroger, people who don't have children with disabilities, people who are still having to work in, caring for other people as their job, and other kinds of service industry don't have time to do that. And so it's people like myself, right, who work at home, who have internet access and, lots of time. I kind of put that in quotes because I'm an academic, because there's never enough time. What is that? What kind, are they really having to go back to work? Probably not. They could probably still do it. My guess is they could still do it in the convenience of their home and be safe and do what they want. They just want that liberty to do it. So it's really concerning. I mean, I think, I've read some really critical commentaries just about how we are sacrificing our elderly, our vulnerable populations for the sake of our economy, right? For our capitalistic model, right? Which is all about making money. And I do agree, and I believe that there are people who really need to go back to work to save their home, and so it's really tough, because I believe there are people who want to get back to work for very legitimate reasons, because they need money and they haven't been able to claim unemployment, or they haven't gotten their stimulus check, or what, not that could pay for everything anyways, right? So there's like a tension. I see it as a real tension where we all want to go back to work, right? And normal, and have these fact that it's not going to be that way for a while. It's sad. It really is sad that is what it comes down to, in terms of the values that we place on people in our society, and how it's okay to say, well, we'll just let people get sick and die. It's disheartening. But I think these kinds of patterns have played out over and over and over again. This is just maybe a little bit more overt, and is a moment to educate, I think, college students, or, whomever. I will definitely use this, right, as another example, right, of the structural inequalities that exist that shape health outcomes, death outcomes, life outcomes. You know, this is, and we're not, you know, there's a whole bunch of research of people doing kinds of like natural disasters and how it inevitably affects people that have limited resources the most, you know, whether it be HIVAIDS, whether it be, you know, viruses, even like the AIDS virus. I mean, that has not gone away, right? And we're seeing that it's affecting people disproportionately there. I mean, it shouldn't be a surprise. Who else wants to say something?
Dr. Singh, there's a question for you in the chat box.
Okay. Should I look? I don't think I have access to chat. If
okay,
I have to end the slideshow.
I can provide the question. So this is from Musu. She's having a bit of trouble with the sound on her computer, so she typed it into the chat box. Her question is, oops, mine just went away too. Her question is there any data for kids on the spectrum on COVID-like effect?
What? COVID life effect?
COVID-like effect. So I'm not sure if she's referring to some of the illness that the CDC has been reporting about the effects of COVID on children specifically. I forget the name. They've given it a name at this point. I think, I'm not sure if that's what she's asking about. Okay. She says that is what she's asking about. So the way that children are presenting differently with the COVID symptoms.
I don't know. I don't know. I'm not a medical professional.
I haven't seen any of that either myself.
Mm-hmm.
It's a great question though. It'd be really important data to collect for sure.
In terms of like, I mean, it's hard because when we're talking about autism and autism spectrum disorder, I mean, some kids can't verbally communicate, for one, right? Some kids have underlying comorbidities as well. It might be asthma, it might be something else. And so I don't know. That's a really good question. Or, you know, may not be able to effectively communicate how they're feeling other than biological signs, right? Like my lungs really hurt when I breathe in might not be a sensation that is communicatable, right? If there's other sensory issues at play. So I don't know. It's a good question to think about.
It is. It looks like we have about 20 seconds until we'll get booted out of this room and back into the other room. But so, you know, on behalf of CLD, thank you so much for your presentation, and to all the participants, thank you for being here and for your great questions. We hope you enjoy the rest of the conference and breakout sessions too.
Yeah. Please be in touch. Dr. Pierce.
Oh, look at everyone. I hope it went well. I love this.
It was really good. I had like about 6 people.
Awesome.
And we had a really great discussion.
Awesome.
Yeah, they were happy. They're like, we're so glad we came.
Yes.
So it was great. Thank you.
You're very welcome. Thank you for hosting it. I hope everything
And
went
so,
well.
yeah. And so on, I guess on the, we'll figure, there'll be a place where we can sort of see all the breakout sessions, because there were some good points that came up that I'd like to review.
As far as what? Tell me more about that.
To watch the recordings of the breakout sessions.
Watch the recording. Yes.
Okay.
As long as everything went well with recording, yes, it will be available.
I don't know. I didn't press anything. So.
Okay. No,
so
you weren't supposed to press anything.
Yeah.
Okay. So I'll follow up with my room moderators and make sure everything went smoothly.
Oh, great.
Okay.
Thank you.
You're very welcome. Y'all have a good afternoon.
You too.
Thank you, Jareen.
No problem, Teal.